Hi, I'm Dan from Correct Osteo Clinic, and today I wanted to talk to you a little bit about tennis and golfer's elbow. So what the difference is between them both, if you're suffering from it, if you have got things like elbow pain as well, what one it may be, so you can differentiate between the two. So you don't have to be Roger Federer or Tiger Woods to have golfers or tennis elbow. All it is normally due to a repetitive strain on the tendons that attach onto the elbow, and depending on where the attachment is and what muscles they are and affecting the tendons, it depends on whether that's golfer's or tennis elbow. So golfer's elbow is also called medial epicondylitis. So it sounds like a horrible terminology, but it's pretty simple. Medial just means towards the center line of the body, and the epicondyle is the bony landmark on the elbow. Okay, so that's all that is. And then itis just means inflammation. So you put them all together, medial epicondylitis. Okay, so that's all that is. And the same for tennis elbow is lateral epicondylitis. So lateral towards the outside of the body, epicondyle again, the bony landmark on the elbow, and itis, inflammation. So that's pretty simple. You just put all those words together and there you go. You've got this horrible medical terminology. That just means simply inflammation of that area. So what I'll do is I'll show you the actual elbow. So these are the bony landmarks that we were looking at here. So these big bony sort of rigids here are, this one here, this big one here is your medial epicondyle. So this is the one that what we call our flexors of our forearm. So down here towards our hand. So basically, if I do that like this, you'll see this is my elbow joint. This is the medial epicondyle, that's the lateral epicondyle over here, over this side. Down there, it goes onto my forearm, and then eventually onto my hand and my wrist. So this bony landmark is located here at the elbow. So you normally find it's really easy to find. It sort of protrudes out quite a lot in this area. And then all what I said about your flexors of your wrist, they all sort of come down. So all your gripping muscles of your hands, they will have to travel up into the forearm as well, and some of them will attach onto this area here. So when you, what I call flex your hand, so when you bring your sort of your fingers, you roll them backwards towards the palm of the hand, and then you can also bring the palm of the hand towards the head like so. Okay, you might be able to see on here with the decent lighting that we've got in here, when I do so, you can maybe see a flexion of some of the muscles in the forearm there, so they begin to work. So like I said, you don't have to be Tiger Woods to suffer from golfer's elbow. You can also even do repetitive movements. Like a lot of manual workers will get this sort of issue. People like, using screwdrivers, saws, that sort of thing quite a lot. Even desk-based people will get it as well, using the mouse a lot, keyboard, that sort of thing as well, can suffer from that motion. Again, with tennis elbow, it's the same thing, same rules apply, just the other side of the elbow. All right, so the lateral epicondyle is located more towards the back of the elbow, okay? So this sort of area here, all right, and this is where what we call the extensors start to attach onto. So we went through wrist flexion, which was so, okay? Extension is the other way, so palm down, all right? And you're starting to sort of bend the wrist backwards, like you're telling someone to stop, okay? Like so, all right? So like that. If you do that, again, you might be able to see here on the video, when I extend the wrist, you're starting to see those muscles in the forearm start to work. And again, like I said, you don't have to be Roger Federer to get tennis elbow. Again, it's like a lot of people, like manual workers and even desk-based workers will get this sort of issue as well. And all it is inflammation of where the tendon attaches onto the bone. That's condyle. Okay, so really quite simple. What you want to try and do is you can do very simple exercises to help get rid of it. So With medial epicondylitis, so that golfer's elbow around this sort of area here, you can suffer from things like weakness and obviously pain in that area. It can feel quite hot and inflamed. So weakness of like things like gripping, you know, pulling the fingers in, flexing the wrist, that sort of thing. That can you can suffer from those. Those are the sort of signs and symptoms that you can get with that. Same rules apply for tennis elbow, just the other side of the elbow. However, you might get things like weakness, again with gripping, but it might be more things like wrist extension, that sort of thing, okay? So pain and weakness when you're doing so. You can also get pain even when stretching out the tendons as well. So when you go to stretch out the sort of wrist and forearm, and so on, that can sort of pull up into that area, okay? So you've got to sort of be careful on how much you are stretching with that, you know? So just be careful with that. However, back to the exercises. So some exercises you can do is some sort of pin and stretching exercises on yourself, okay? So what you can do is shorten the muscles by flexing and the fingers, so bring the fingers towards the palm, and again bringing the palm sort of up towards the inside of the forearm, okay? So like so, all right? Now you don't want to do that to strain that too much, because obviously it might be painful when you're doing so, and you might even have a bit of weakness there, but just try to shorten it as much as you can, and even a little bit of the elbow as well. You're going to take a bit of pressure around the inside of the elbow, not on the actual bone, just below it, okay? So what you can feel, if you start flexing your wrist like so, you'll start to feel those sort of tendons pushing into you. That's where you want to be with your thumb, okay, when you're in that position. And then what you want to try and do is slowly take it into an extended position like that, okay? So you push down on the grip, all right, not too hard, obviously, you don't want to hurt yourself further. How much you can sort of not so much tolerate, but you know, so you've got enough pressure there so it feels comfortable enough. And then you want to start to then extend the wrist like so. If you get quite good at that, you can use other things like a wall to help extend the wrist, you know, a table, anything like that as well, like this, and you can start to stretch out those tendons, okay, those muscles there. So that's a very simple one, just a pinning and stretching type motion. You can, if you want to, go from the actual tendon attachment and try to follow those flexors down, okay? So follow the actual muscle down as well, so while you're doing that sort of pinning and stretching motion, okay? Simple one, even more simple than that, is just the stretch, okay? Like we said earlier, you can use something like a table, like so, to stretch out those flexors, okay? And even the extensors, so you can go the other way as well, all right? Like that. You can use a table or wall, something that's quite static, quite sturdy, that's not going to move if you're putting too much pressure down onto it, all right? And then you want to feel that stretch along those areas, okay? So you can use things like ice, getting a little ice pack, frozen peas, whatever you can really, and you can start to place that ice for 5 minutes at a time onto the affected area, okay? So you can try and do that, put it on for 5 minutes, take it off for 5 minutes, back on for 5 minutes, okay? Try and get that sort of inflammatory symptoms down with the ice. You can do that daily as well, okay? Another one that's quite simple, if you've got something that's quite firm, like I've got a massage ball here, however you can get something like a cricket ball or a hockey ball, something that's quite firm, alright? Tennis balls normally collapse under pressure, so they're not very good with that, so you can start to use these sort of things as well. You can get them off Amazon, absolute peanuts, you know, and you can get them the next day if you're a Prime user, very easy. So with this side of things, you can get a table again, so we're just going to go down to the table ever so slightly, and what you can do is do a bit of self-massage work onto the actual forearm muscles and the tendons as well, like you're going to roll up and down. With that, while you're doing that, while the pressure's on that area, you can start to extend the wrist as well, like doing that, okay? And then roll up and down onto that muscle. All right, same rules apply, but for the other side of the arm, okay? And then you pinning and stretching as well with that, just like you would with your thumb, but you're doing it with a massage ball. All right. So some exercises that could help as well. A lot of people can use some very simple sort of DIY things that you might have around the house. I've just got a case here for one of our tool assisted therapy things, but you can use things like a hammer and so on. So what you want to try and do is do a little bit of weighted supination and pronation. Okay, so supination is turning the palm up towards the sky, and pronation is turning the palm down towards the floor. Okay, so you can do that. All right, so you're working those muscles of the forearm and the elbow while doing so. All right, nice and controlled. You don't want to be too quick, like so. Obviously, you want to be nice and controlled, like doing that. So a very simple exercise, like so. Another one you can do is, if you've got a weight or a resistance band, if you've got like a little dumbbell at home, doesn't matter if you haven't got any dumbbells, you can even use a bottle of water to do so. You can do things like flexion and extension of the wrist. So I explained to you earlier what flexion and extension is of the wrist. You can do a resistance band, take it with the other hand, use a little bit of resistance. So what you can do, grip the resistance band and then start to flex and extend. Okay, so like that. And then what you're going to try and do is work the flexors of the forearm again. All right, so these are more preventative for further injury type exercises. All right, but at the start, like I said, you can just do as simple as stretching the muscle out, bit of pinning and stretching yourself, or even use a massage ball onto the area. Okay, but yeah, these other exercises, and the ice as well. But the other ones that I showed you, those exercises, they're more for preventative signs and symptoms. All right, those things. If the issue persists and those exercises don't help too much, please just give us a call, come in, we'll have a look at it for you, we'll see what we can do and try and help you as much as we can. But those hopefully should get to the bottom of it. But like I said, if it persists, if you are constantly using overuse stuff with flexion and extension of the wrist, that might be a bit more of a cause for it, and it might keep coming back. So that's when we'll start to try and intervene with that for you. All right, hope you have a good day. I'll speak to you soon. Thank you.